Hi, I'm Gilles Bolduc, and welcome to my video on Principles of Infectious Diseases and Epidemiology. The goal of my video is to introduce the science of epidemiology and describe how epidemiologists monitor and contribute towards the controlling of future disease outbreaks. So let's begin by defining a few key words. Let's begin by defining the word colonization. It's said that the average human body is made up of 37 trillion cells. We can write that in three different ways, but that's only half the story. Our body also has a normal flora made up of many different microbes. These microorganisms are said to colonize our bodies. The areas that I've highlighted here in blue show where these microbes can be found with respect to our bodies, in or on our body. The rest of the body that's not highlighted in blue should remain microbe-free. It's also estimated that the average human person carries 10 times more bacterial cells in and on his or her body at any given time. So we can say that he or she is colonized with 370 trillion bacterial cells, because it's mostly bacterial cells, all of which don't make up the person, that do not make the person ill. So in fact, these microbes are helpful to the body in many, many ways. So again, we say that these microbes colonize our body. So let's compare what I just said about colonization with that of infection. So when you go to your doctor and he or she tells you that you have an infection, what he or she is actually telling you is that you have a microorganism present in or on your body where it normally shouldn't be found. So let's take an example, Staphylococcus aureus. Most of you have heard of Staphylococcus aureus, also known as Staph aureus. 40% of the time, we carry Staph aureus on our skin. We don't call this an infection because it's part of our normal flora and it doesn't harm us. Thus, the human skin is colonized with Staph aureus 40% of the time. But if someone happens to cut themselves, the bacteria has the chance of penetrating through the outer layer of the skin, thus entering the blood. This person now has a Staph aureus infection because Staph aureus should not be found in the blood. Now, if the presence of that organism harms the host, in this case Staph aureus, then the host is said to now have an infectious disease. Infectious disease is basically a functional disorder suffered by the host that's caused by the microorganism. So I've defined infectious disease on this slide simply by saying it's an illness that's caused by the presence of a pathogenic microorganism that's growing in or on the infected host. Now, the reason why I put the word pathogenic basically implies that the organism is causing harm. So if I use Staph aureus as an example again, if Staph aureus enters the blood, it can then spread to internal organs and cause severe adverse conditions such as toxic shock syndrome. Whereas when it was colonizing the skin, it didn't cause any harm whatsoever. Now, as you're probably aware, that each different microorganism has different effects on the human body. And so these different effects is what defines the type of disease. So in order to help determine the cause and the treatment of a disease, doctors look for the adverse conditions known as signs and symptoms. Now, signs are objective. That means that a healthcare provider, for an example, can see and measure the degree of the effect on the person. So, for example, fever. We can measure fever by using a thermometer. Paralysis, we can see the amount of paralysis on a person by monitoring the lack of movement, etc. So is it partial paralysis, complete paralysis, etc. Now, symptoms, they're subjective. These effects can't be measured by someone else, but need to be described by the person who's suffering that disease or the effects of that disease. So, for example, you go to your doctor and your doctor will ask you, on a scale of 1 to 10, how bad is the pain? Because he or she can't determine the amount of pain you're suffering simply by looking at your outward appearance. So together, the collection of these signs and symptoms are specific to that particular infection, a particular disease. So together they define the syndrome. So the syndrome is the complete set of signs and symptoms that are associated with that specific disease. So knowing these basic definitions of what signs and symptoms are, you should be able to classify each of these adverse effects that are associated with having the flu as being a sign or a symptom. So remember, the flu is caused by the virus called influenza. Feel free to pause the video while you assign each of these effects as being signs or symptoms. Okay, so now we can start talking about what epidemiology is. Epidemiology is a science that examines patterns, causes, and effects of disease on the health of a given population. Now, it's important to stress that epidemiologists don't just study infectious diseases, they also study other diseases. So remember, not all diseases are due to microorganisms. But since I'm a microbiologist, this is what I'm going to focus on in this video. So as epidemiology is a science, we need somebody who studies that science, and these are epidemiologists. So an epidemiologist is a scientist who's trained to identify the factors that cause disease, that transmit disease, and that help prevent or reduce future diseases. So to identify these factors, epidemiologists can break down their studies into 4 major branches, as I've shown here. The first one is to determine the disease etiology. Etiology is the causing agent. So what organism is the cause of this particular disease that they're interested in? Secondly, the outbreak investigation. How, when, where, and why did this outbreak happen? Third, disease screening and surveillance. Can we predict future outbreaks based on what we know now? Lastly, comparisons of treatment effects in clinical trials. Will modern treatments help prevent future cases of diseases from occurring? So let's begin by discussing what an etiology is. So as I just said, an etiology is what causes the disease or the condition. Thus, the etiological agent is a particular microorganism that is responsible for producing the adverse effects on the host, thus leading to the infectious disease. So an epidemiologist wants to know what type of microorganism is causing that disease. Is it a bacteria? Is it a virus, a protozoa, a fungus, or an algae? The more information that he or she has on a particular microorganism, the better that they are at understanding how to control the spread and how to prevent future transmission. Now, at times, the epidemiologist may know exactly what the microorganism is, as specifically as their genus and species name, but other times they might just know this broad category. As an example, is it a bacteria or a virus, etc. But knowing that will help in the treatments. Whatever information they can have will also help them understand how the etiological agent can be spread. So for example, is that microorganism that's causing this outbreak in diseases, is it transferred from person to person? So if so, who was the first person that was infected? Or could it be spread by animal to person? In this case, this type of disease is known as a zoonose or a zoonotic disease. The infectious agent is typically endemic or found in an animal population, as an example rabies, and when the human comes in contact will be then transferred to the human. So if it is a zoonotic disease, what's the animal reservoir? All these questions come up. Another possibility is that this microorganism can be transferred through arthropod vectors. Arthropods are ticks, mosquitoes, fleas, mites, etc. And they're vectors because they are living organisms that can transfer a microorganism from one host to another. So, as an example, we know that Plasmodium is a protozoa that's transferred from mosquitoes onto humans that lead to malaria. So, if it's an arthropod vector, leads to the question is, how can we prevent exposure to these arthropods? Where are they found? Are they only found in a certain area, in a certain country, etc.? So knowing the etiological agent will also help us understand if a certain population is at risk. So, is there a certain group of people that are being infected and not others? Is this associated with behavioral risks or lifestyle factors, such as is it work or cultural related factors, or is it simply personal choices? So again, the more we know about these microorganisms, the more that these questions are being answered, the sooner we are trying to prevent future outbreaks. So while one is trying to figure out what the etiological agent is, an epidemiologist can also be investigating an outbreak. So let's define what outbreaks are. But before an epidemiologist can determine that an outbreak has occurred, there's a lot of information that has happened behind the scenes. They need to first determine if the microorganism is endemic to the region being investigated. So an endemic disease is a disease that's constantly present at a steady frequency within a particular region. So we have to define what that region is. This frequency can be different from region to region. So as an example, malaria. Malaria is an infectious disease caused by 4 different species of the protozoa called Plasmodium. It's endemic to certain tropical areas of the world. That's to say that a percentage of humans and mosquitoes in these areas are constantly infected with this parasite. As long as that percentage doesn't increase substantially, malaria is said to be endemic to that area. But there's no outbreak yet. However, if malaria is suddenly reported in a geological region such as the United States, that is not normally reported as having malaria cases, then the minute we have 1 or 2 cases, we have an outbreak in the US. So an outbreak, let me define it here, when there is a reported increase in the incidence or the number of cases of a disease above the reported endemic level. That outbreak can affect a small localized group or it can impact thousands of people across a continent. So again, as long as the numbers stay constant, it's endemic. But once the number of infected people increase way above that endemic level, it has become an outbreak. So now we know that we have an outbreak. It's important to classify that outbreak so that we can better understand how that disease is spread. So we have 3 major outbreaks classifications. The first one being that of sporadic outbreaks. These outbreaks occur occasionally, and there's really no set pattern to them. They're random. So here I'm representing a population of healthy individuals in white and diseased individuals in yellow. Sporadic outbreaks are repeated outbreaks of the same disease where 1 or more people come in contact with the disease, and it's difficult to predict when the next outbreak is going to occur, as well as the overall impact on that population. Again, because these outbreaks occur infrequently and irregularly. Next are the epidemic outbreaks. During an epidemic outbreak, there are several cases of people suffering from the same disease, which is significantly higher than that normally found in that region. Epidemic outbreaks may affect individuals within a small area, such as your local neighborhood, or it could be as large as an entire country. Thirdly, are pandemic outbreaks. These outbreaks are similar to that of an epidemic outbreak, except on a larger scale. So pandemic outbreaks can span across more than 1 country, as well as spread across the entire world. Okay, now by being able to classify the outbreak as one of these 3 major categories, it helps us understand the severity of the outbreak, as well as the population size. So now we also need to identify how that agent, the etiological agent, is being spread among that population that we've just defined. So next, we want to identify the source. So what is the reservoir of this etiological agent? Knowing that, we can ask the questions, how can we avoid coming into contact with it in the future? So given a certain population, how can that population be separated from that reservoir to prevent future diseases, future outbreaks? If possible, we could also ask, how can we destroy that microorganism? It might require destroying that reservoir. Secondly, how is the disease spread? So is that organism spread by person to person, as we mentioned earlier, or is it a zoonotic disease where it's spread from animal to person? It's also possible that that organism is spread by water, or is it an airborne disease? Knowing how it spread will help identify ways to prevent future outbreaks. Next, how many people can be expected to become affected without medical intervention? So, epidemiologists try to answer this question by reporting incidences over time. They record them. They make graphs that help predict future rates of infection. So if the outbreak is left to continue on its own without medical intervention, then it should follow the same pattern. And lastly, how severe is this disease? Are there any deaths that are involved with the disease? We'll call this death mortalities. So if there are any mortality rates, or if the mortality rates are high with this outbreak, then obviously there's a greater urgency to reduce the spread of the disease before it infects more people. So I quickly touched on the use of surveillance and screening on the previous slide when I mentioned that epidemiologists use graphs to predict future outbreak patterns. So I want to discuss that a little bit more here. Now, we have an organization here in the United States called the Center for Disease Control and Prevention. For short, we call it the CDC. The CDC plays a key role in monitoring potential outbreaks within the United States. They send out weekly reports that they publish here on the web to inform all those people interested of major developments in the U.S. Likewise, we have a more global organization called the World Health Organization, who collects information from the CDC as well as from similar institutions in other countries. And together they help monitor the spread of disease across the world to help determine if there are any outbreaks or any emerging diseases that occur. All this data collection is very important to help us define the disease state or the disability that's caused by these infectious diseases, as well as the overall poor health that's caused by the disease or outbreaks. We then use this information to determine the rates of incidence or prevalence of that disease. So together, this data, this incidence and prevalence, is a way of defining the effects that the disease has on a given population that's being questioned, that's being investigated. So let's define what is meant by prevalence and incidence. So let's start with prevalence. Basically, prevalence is a measurement. It measures the total number of cases of disease in a given population. So for example, if an epidemiologist finds that there are 10 people out of a population of 100 that suffers from meningitis as an example, that total number of cases is 10 out of 100 people with meningitis. So we can say that 10 out of 100 people are currently suffering of meningitis. And as you've learned in math classes, that you can reduce that number and say 1 out of 10 people suffer. So that gives you the prevalence rate. Now, the important thing to stress is that this number includes all the new cases as well as pre-existing cases. It's the total number of cases at that given number of time. And so below the slide here, I've given you the mathematical equation. So now let's compare that with incidence rate. Incidence measures the number of new cases over time that's been reported within a given population. So what I want to stress here is simply just the new numbers. So this number measures an individual's chances of developing or contracting that disease if that person lives in that given population. So let's give an example. The population has 1,000 people, but already there's about 100 people that are walking around that have meningitis. But if we're looking at the incidence rates of the past year, we're going to look at just the number of new cases. And there just happened to be 10 reported new cases within the past year. So we'll consider those 10 people, not the 100 people that had meningitis that developed prior to that year. So we'll say that the number of new cases is 10 within the specific time, the year, over the total number of people in that population, which is 1,000. So we will say that the incidence rate is that there are 10 newly reported cases out of 1,000 people per year. This is the same as saying that the incidence rate is 1 new case out of 100 annually. So if you were part of that population, you have a chance of 1 in 100 of acquiring meningitis within a year. Okay, so far we talked about prevalence and incidence, but these two just give a small picture of the effect that this disease will have on a population. We also have to consider if there's any mortality rates, any deaths that are associated with the disease. So sometimes death can be associated with the most severe disease outbreaks. The number of deaths associated with this particular disease would be called the mortality rate. And again, like prevalence and incidence rates, mortality rates can just be calculated simply by dividing the number of deaths associated with the disease by the total number of people in that population. Again, if you want to give it within a time period, that's also good. And often epidemiologists do that also. Okay, so what's the point of all this monitoring about defining prevalence, incidence rates, mortality rates? The whole point is to report the number of cases in graphs similar to this. So this graph basically looks at the prevalence, the number of cases reported. This is a fictitious disease called disease X in the United States, and it was monitored from 1965 to 2015. Basically, what this slide shows you is that, there are some ups and downs. There are times where there's more cases of this disease X than other times. And you could probably just draw a straight line to get an average that would be around 450,000 cases annually. Now, if the disease goes untreated, then you can predict in the future that this rate will stay the same. And so I've zoomed ahead on this graph, and I've extended the reporting cases. Let's speed up to 2025 and say these are the cases that we've seen. And again, there's nothing dramatic about this. This disease is within this population. You might even say it's endemic because I don't see any major outbreaks. Sure, there's some peaks, but overall, this was probably the endemic level of this disease. Okay, so this brings me to my last point. That's taking this surveillance and screening and using that, comparing that with treatment effects. So let's look what kind of clinical trials, because whenever you get a new drug, you first have to do clinical trials. Okay, here is disease X again in the United States, and in this case, it was reported from 1965 to 1996. And in 1996, a pharmaceutical company came up with a new treatment to prevent or hopefully prevent disease X. Now, this treatment could be a vaccine-based in nature, or it could be a chemical drug that basically reduces or outright kills that organism that causes this disease. So, epidemiologists want to continue monitoring this. Now, what would you expect if the treatment was beneficial? Obviously, you'd see that the number of cases would go down. If the treatment had no effect at all, then you'd see the same type of profile as the years continue. And lo and behold, this was the effect of the study in the clinical trials. And it showed that from 1996 to 2003, roughly, that basically the number of cases reduced. Now notice the scale on the y-axis is number of cases per 1,000. So there's roughly, it goes from 550,000 cases to around 200,000 cases. Now that's substantial. That's more than half the amount of population. It's reduced the disease by more than half the incidence. So having this information, you could say that treatment is about 50% successful. Now, you wouldn't know about the success if you hadn't done all the recording and the reporting early on since 1965. And so again, the importance of monitoring and surveilling these diseases, and again, following them with clinical trials. Okay, so I'd like to end this video by summarizing that epidemiology is basically a science that studies the spread and the control of diseases, not just infectious diseases. Since a subset of diseases are infectious diseases, though, epidemiology is considered a branch of microbiology which monitors and controls the spread of infectious diseases. So basically, an epidemiologist is considered a detective because they're doing a lot of detective work. But beyond epidemiologists, everyone should be aware of how microorganisms can be spread. so as that they can better protect themselves as well as others around them. So with all of this, I hope that you now have a better understanding of what an epidemiologist does and how important epidemiology is in the prevention and controlling of the spread of diseases. So thank you, and this concludes this video.